this quest. Tackling obesity is inextricably linked to tackling health inequalities. In Hull, 5 years ago, a far-sighted Labour council introduced free, healthy school meals for all its primary school pupils to help tackle the twin problems of child obesity and low levels of educational attainment. The experiment was to last 3 years. It was scuppered by an incoming Liberal Democrat minority administration at the exact time, incidentally, as their national party was pontificating on the need to be radical about healthy eating. Typical Lib Dems, I hear you say. Perhaps their astonishing inconsistencies has something to do with changing their leader too often. You can say what you like about Ming Campbell. At least he was well acquainted with the level of the state pension. Conference today, Ed Balls and I have agreed to pilot free, healthy school meals for all primary school pupils in at least 2 local authority areas. We'll examine the results so that we can gauge whether the clear early improvements in Hull are sustainable elsewhere. A measure that tackles the issue of obesity at the same time as tackling the issue of poor educational attainment. But tackling health inequalities means ensuring that those areas with the greatest health needs no longer have the fewest GPs. This is one of the reasons we're introducing so many new GP surgeries right across the country. The Tories oppose this additional capacity as they oppose surgeries being open for longer. They are impervious to the need for quicker, more convenient treatment. They probably think a GPQ is a new upmarket men's magazine that Cameron should be doing an interview with. But let us at least be grateful for Damascene conversions. The Tories say they are now committed fully to the NHS they originally derided and the spending levels they recently opposed. At the next general election, they will ask the British people to forgive and forget their neglect and underinvestment in government and the notorious patient passport that they promoted in opposition. But their new policies are just as irresponsible as their old ones. At a time of global economic uncertainty, the Tories want to encourage hospitals to borrow against their own assets without Treasury guarantees. They freely admit this could lead to hospitals going bust, putting essential NHS services at risk. The prospect of your hospital being repossessed lies beneath the slick PR of David Cameron's Tories. They would abandon the maximum 18-week wait and the 2-week limit on cancer referrals, scrap MRSA control targets, oppose greater patient access to their GP, stop the expansion of primary care, and reorganise the whole of the NHS into a giant unelected quango. The future of our health service is the battleground for social justice. We have to take this fight to the Tories, every one of us, because if we fail not just ourselves and our party, but the poor, the disadvantaged and the sick who will be left behind in Cameron's Britain. Whilst we rightly praise Bevan, we know that the NHS wasn't created by one man. It was established by a united Labour government. It could never have been restored in only one parliamentary term, and it won't grow and improve if we consign its future to the Tories. Gordon Brown's vision and leadership has been the major factor in our success in tackling healthcare problems over the last year. You heard yesterday about his ideas and his personal mission to provide the people of this country with a health service that leads the world in quality, accessibility and pioneering medical research. He has recognised more than anybody that the NHS stands as the clearest application of Labour's values and a shining example of what more we can achieve together if we can win the public's trust for a fourth term in government. Thank you.